Tinnitus, a condition that is often misunderstood and overlooked. It's a condition that affects millions, cutting across age, gender, and ethnicity. A phantom noise only the sufferer can hear, making it an isolating experience. Imagine a constant ringing, hissing, or roaring in your ears, day and night. Even history's greatest minds like Leonardo da Vinci and Charles Darwin experienced tinnitus, showing that it spares no one. Tinnitus can disrupt sleep, interfere with concentration, and lead to social isolation. The constant noise can make it difficult to focus on tasks or enjoy social interactions. For some, it's a minor inconvenience. For others, a constant torment that affects their quality of life. The invisible nature of tinnitus often leads to misunderstanding and lack of empathy from others. Many believe it originates in the ear, but its true source lies within the brain, where the auditory system misfires. The brain sometimes misinterprets signals, creating the illusion of sound that isn't there. Understanding tinnitus helps us appreciate the complexity of the human auditory system and the challenges faced by those who live with this condition every day. To understand tinnitus, we need to appreciate the intricate symphony of sound processing in our brains. This complex process involves multiple steps, each crucial for us to perceive and interpret the sounds around us. Hearing begins with sound waves entering the ear canal, causing the eardrum to vibrate. These vibrations are the first step in a remarkable journey that transforms sound into something our brains can understand. These vibrations are transmitted to the middle ear, where three tiny bones, known as the ossicles, amplify and transfer them to the inner ear. The ossicles play a vital role in ensuring that sound energy is efficiently passed along. The cochlea, a snail-shaped structure in the inner ear, is lined with thousands of tiny hair cells. These hair cells are essential for converting sound vibrations into a form that the brain can interpret. These hair cells convert mechanical vibrations into electrical signals. This conversion is a critical step in the hearing process, allowing the brain to receive and process sound information. The auditory nerve carries these signals to the auditory cortex in the brain. This nerve acts as a bridge, ensuring that the electrical signals reach their final destination. Here, the brain decodes the information, distinguishing between different sounds. This decoding process allows us to recognize and understand the myriad of sounds we encounter daily. Any disruption along this pathway can lead to hearing difficulties, including tinnitus. Understanding this pathway helps us appreciate the complexity of hearing and the challenges faced when it is disrupted. Tinnitus originates in the brain's neural networks, not the ears. While many people think of tinnitus as an ear problem, it's actually a complex neurological condition. The brain plays a crucial role in how we perceive sound, and when things go wrong, it can lead to the persistent ringing or buzzing known as tinnitus. When hair cells in the cochlea are damaged, they fail to send the usual signals to the brain. These hair cells are responsible for converting sound waves into electrical signals that the brain can interpret. As a result, the brain receives fewer signals. This reduction in auditory input can cause the brain to react in unexpected ways. To compensate, the brain turns up the volume on the remaining signals, amplifying them to make up for the loss. This is an attempt by the brain to maintain a normal level of auditory perception. This process is known as neural gain. Neural gain is the brain's way of adjusting the sensitivity of its auditory pathways to ensure that it can still detect sounds. However, this amplification also increases the brain's inherent neural noise. This neural noise is essentially the background activity of the brain's auditory system. This amplified neural noise is perceived as tinnitus. The brain interprets this noise as a constant ringing or buzzing sound. It's the brain's way of filling in gaps, trying to make sense of the incomplete auditory information it receives. This is a form of sensory compensation. The brain is constantly trying to make sense of incomplete auditory information. It attempts to create a coherent auditory experience, even when the input is lacking. Understanding this process helps us grasp the complexity of tinnitus. It reveals how intricate and sensitive our auditory system is. The brain's attempt to adapt can create phantom sensations. These phantom sounds are a result of the brain's effort to fill in the missing auditory information. This highlights the need for effective management strategies. By understanding the brain's role in tinnitus, we can develop better treatments and coping mechanisms to help those affected by this condition. The phantom sounds of tinnitus carry significant psychological weight. For some, tinnitus is a relentless source of stress, anxiety, and despair. It can disrupt sleep, impair concentration, and make daily activities challenging. The invisible nature of tinnitus can lead to feelings of isolation and misunderstanding. This lack of understanding can exacerbate feelings of loneliness. The more distressed a person feels, the more they focus on the sound, amplifying their perception of it. This cycle can make tinnitus feel inescapable, leading to hopelessness. While there's no one-size-fits-all cure, various strategies can help manage tinnitus. Sound therapy uses external sounds to mask or distract from tinnitus. This can include relaxing music, nature sounds, or white noise machines. Cognitive behavioral therapy, CBT, helps change thoughts and behaviors related to tinnitus. CBT aims to break the cycle of negative thoughts and sound amplification. Medications may address underlying conditions like anxiety or depression. While not a cure, they can help manage psychological symptoms. With the right combination of therapies, individuals can find peace amidst the phantom noise.